We got called in the middle of the night.
And I believe I got the phone call, I want to say about 4:45, 5 o'clock in the morning.
Family doctor in West Point. He'd had a baby born without any problems, and then he noticed that the uterus inverted, just turned inside out.
Which is a very life-threatening condition.
And when we got that call, they said, as soon as the West Point EMS staff can get her here, we've got to go to surgery.
When they took my daughter away, I didn't know what was happening with her. I thought she was gone. The weather that night was really bad.
It was ice, it was snow, it was rain mix, and there was so much slop on the roads it just pulled you everywhere.
Because helicopters were not running that night because of the weather, they put her in an ambulance and transported her here to Fremont.
If I didn't get there safe, then I knew I wouldn't see Danyelle. So I had to take precaution.
And you just kept driving because you knew you had to get to work.
I think DMT crews did a good job getting her here in a hurry in kind of bad weather.
And I remember her coming down the main OR hallway. She was on a stretcher.
The gurney was covered in, obviously it was blood, but her blood was not red, it was pink. She had lost so much blood. She was literally a floppy wet noodle.
It was kind of an image that I won't forget.
One of my thoughts was, can we save this girl? It was that critical.
In this profession, there's always uncertainty. We always work to have our patients have the best outcome, but it doesn't always turn out that way.
There's always that chance that something can change.
And it was really tough. You stop and think that's your child. That's all you have.
There were 7 staff members working on Danyelle, and if you were standing outside the window looking in, it probably looked like chaos.
It was controlled chaos, so have a very good surgical crews.
You know, the team is moving her over, they're putting her to sleep, they're prepping her belly, they're doing all the things we normally do, but it's in such a hurried fashion, in a safe fashion all at the same time. It really brings out what we do and how well we can do it for the sole purpose of saving a life.
We were rapidly giving her blood and fluids, made the phone calls to all the departments, saying we need more blood. I was underneath the sterile drapes, starting IVs.
Her systolic blood pressure was running around 40 at that point, which is very low. It should be about 110, 120 normally. We started blood right away and fluids and got her stabilized enough that we could go ahead with the surgery.
Nobody had to be told what to do. Nobody had to be asked to do anything. Everybody just stepped up.
There wasn't any panic, although we were really concerned for her, of course, but everybody just did their job.
It's a sole matter of teamwork and everyone coming together to do the best you can do and still hoping for the best, not knowing what's going to happen at the end.
I didn't know things were going to be okay until I heard Dr. Kiesling say, "I got it."
And at that point, things settled down, and the bleeding stopped. She stabilized. She did very well after that.
Patty cake, baker's man. Bake me a cake as fast as you can. Roll it up, throw it in the pan. Patty cake, baker's man.
Pappy.
I just relive it in my head. This is something you can't forget. It's like it was yesterday. I have my family and my kids. I'm, healthy and I'm here. I mean, if it wasn't for Fremont Health, I wouldn't be here.
If the doctors and nurses were here, I would go up and hug them and thank them for bringing Danyelle back to me.
It's not often that I leave work and cry, but yet you're just like, wow, I really had a role in saving that patient's life.
Your adrenaline is so high thinking, I have a life I have to help save. And then when you're done, you're thinking, what did we just do? We saved someone. It could have been a daughter of my own. And we're thinking, can we save this girl? And luckily enough, we did.
We have the facilities and the resources right here in Fremont to provide the higher level of care that Danyelle needed.
Honestly, don't think, given the situation, that she would have made it to Omaha. But I think we have an exceptional hospital, exceptional staff, and many people don't realize that.
The nursing care here is second to none. I've worked at a lot of hospitals, Omaha, Wichita, Houston, and here in Fremont, and I would choose to come here. I think it's an excellent place to be.
I'm confident in the care we provide at Fremont Health because it's almost as if we're a big family.
And we trust one another. When one of us have surgery, we know that we're getting the best care possible. We don't have to think about going somewhere else because this is still home.
Looking back, it's rewarding to know that we were able to give Danyelle a chance to be a mom to her 2 little kiddos.
She's got a second chance at life that could have been taken.
I live for my kids. I live for every day because they're my world. And I have Fremont Health to thank for that. For giving me. It seems like a second chance.